I'm Jeremy Brockway, Director of Software Architecture at Mimvista Corp.
And what do you guys do?
We specialize in radiology viewers and also contouring tools for radiation oncologists.
So I'm familiar with the old applications that we've seen of like sliced humans and stuff like that. You guys are not that, right? What are you guys so that the viewers can understand?
So we're used actually in for example, a clinical environment like in a radiological reading room. So you get scanned by a modality like a CT or a PET scanner, and that image is transferred to our workstation where the radiologist would, at that time, use our software to make a diagnosis. So we have an iPhone app which allows for some interesting things in applications like offline reading or an overread in a collaborative type of environment. Okay, so here we're seeing a fusion of a CT and a PET image. So I can swipe left and right to change to this is just the CT, and I can move through the slices by sliding my finger on the right edge.
What are the different scenarios for usage here?
So a physician that, say I went in today for a scan, I wasn't feeling well, and the physician said, well, you should go see a hospital and get a scan, and that scan would be sent to a radiologist. They would perform a read, and then they would send the results back to the physician that referred me to the radiologist. And maybe if I had cancer at that time, that physician would then refer me to an oncologist. So our software could be used both in radiology to make the diagnosis and also in radiation oncology to delineate and segment the anatomy and the target areas for sending off to treatment plans. This is just the PET, and I can do the same. And then we can go back to the fusion. And this is displaying both of the image sets with the PET overlaid on top of the CT and aligned, so you can see that you can see both images, and we can blend between the two of them. One interesting thing I could see in maybe like a third world developing country where they don't have a lot of revenue or money to have imaging centers or personnel to actually do the reads on site, they maybe could have a centralized reading center. Everybody goes there for the scans, and then they could push the data out to experts that may or may not be in the country even. We can do a two-finger touch to reset. We could adjust color tables. Oops. We can do most of the things you would expect, like zoom and pan. Our mobile solution will continue to be, at least for the near future, iPhone and iPod Touch only. Mm-hmm. And as I said a little while ago, the desktop solution in May, when MIM 5 launches, it'll be the first time we're ever available on the Mac. So we'll be both on Mac and Windows. We also have some measurement tools. You could place 2 points.
Oh, wow. Very nice.
We can also show a MIP movie, which is a maximum intensity projection.
Are you guys privately funded, or what kind of backing is happening?
Yeah, we're a privately held company based in Cleveland.
Jeremy, thanks so much for your time. We appreciate it. Look forward to seeing what happens in the future with you guys.
Thank you.
Bright up the fair for crossing the river, for leaving the store.